So first we're going to talk about osteoporosis. What is it? And there's a lot of confusion. It's a decrease in bone density, right? And the less dense your bones are, the more likely you are to fracture. Makes sense. So we'll talk about that. Kristen's going to talk about some of the treatments. She runs a clinic up there. I oversee it with her, and she provides treatment options, whether it's medications, exercise, calcium, vitamin D, whatever she thinks you need after the initial evaluation. And I think it's important because hip fractures are increasing in the United States. It's some of the highest in the world, and we need to do something to prevent that. So let's get started, and we'll answer questions afterwards. And I'm here for you guys. Any questions, happy to answer them. So I'm an orthopedic surgeon. I've been at ETMC about 13 years. I see a lot of fractures. These fractures are known as fragility fractures. Minimal trauma can cause them. Sometimes the bone breaks before you even fall. I've taken care of like 4 in the last 2 days. You know, patients, weak bones, fall, and then we ended up fixing them. So it's a surgery. And surgery itself is not without complications. So if we can do something to prevent these, I think that's the way to go. So we'll talk about what is osteoporosis. Well, it's when the bones are fragile. They're more likely to break. And I get some patients that ask, so it's broke, it's not fractured, or it's fractured, not broke. They're the same thing. Okay, so somebody says you got a fracture, that means you broke it. And these fragility fractures, when I say fragility fracture, I mean, well, it's patients that their bone's not as dense, so they're more easy to break. And they can occur with just minimal trauma. And like I said, some can occur before you even have a trauma. A hip can break and then you fall, or you fall and break a hip. It can go either way. And these fractures, well, they can lead to deformities, especially the ones of the spine, where you get these compression fractures, which we'll talk about. Well, then you're hunched over. Well, you're hunched over. Well, it's cosmetic. Nobody wants to be hunched over if they can avoid it. You can have trouble breathing. Lungs can't expand as well. So this is an important topic. And you may not even know you have osteoporosis. The only way you're going to know it is if you have a fracture, right? And it's painful. Or you get bone density testing, which Kristen will talk about, to try to prevent this. Let's look at a bone here. So, one, bones provide structural support. Well, kind of know that. 99% of the calcium in the body is stored in bones. 1% goes through the body, bloodstream. It helps muscles and nerves work. But 99% is in the bone. Well, bones help us with movement. Tendons and muscles attached to bone help you lift your arms, move your legs. Blood cell production. In the middle of these bones, some of these spongy bone and this medullary cavity produces blood cells. Well, what's a blood cell? There's red blood cells, carry oxygen throughout your body, need oxygen. There's white blood cells. Well, they help fight infection. So you get infection, the white blood cells are mobilized, fight infection. The periosteum is kind of an outer covering of a bone, and there's nerves in there, right? So when you break a bone, those nerves signal to the body, hey, something's wrong. And then compact bone is also called cortical bone. Well, that's the hard outer shell, right? So this osteoporosis, you're not making enough bone, that shell will get very thin. And we see these x-rays, the bone look expanded, real thin shell on it, and we know that patient has osteoporosis even before the DEXA scan's done. On the left, healthy bone. This is underneath the microscope. And you can see how these are thicker right here. These are called the trabeculae. Well, an osteoporotic bone, they're thin. You can see these would be more fragile than this. You're more likely to break with this bone than this bone. And then there's something called osteoblasts, osteoclasts. Your bone's constantly being remodeled in your body. So a kid, their entire skeleton is remodeled in 2 years. Somebody older, 67 years old, about 10 years for that whole skeleton to remodel. Osteoclasts chew up bone. Osteoblasts build bone. And there's medications for osteoporosis that affect both. We'll say this here is an osteoclast. Going over here, destroying part of the bone. Okay, you got a hole. Well, then osteoblasts come in, rebuild the bone, and this here is a resting phase. So gets destroyed, gets built. It's a constant cycle. So this looks at changes in your bone mass. When is your bone the strongest? Well, as you're growing up, your body's depositing calcium, making the bone strong. So our peak bone mass, around between about 35 years old, there's things that affect bone mass, okay? Well, your genes, maybe have family history, that plays a role. Every family has osteoporosis, right? You're probably going to get osteoporosis too. Whites, Caucasians, Asians, higher incidence. Exercise. Well, did you exercise a lot growing up? Do you continue to exercise to keep your bones strong? That plays a role. Your nutrition, what you eat. Eat bad, don't eat. Well, poor nutrition can affect you building bone quality. As we get older, the bone density, how thick and strong it is, goes down. And especially when menopause comes for women. It's hormonal changes. There's about 5% a year of bone loss after that. So, real important to get treated. So the risk of a fragility fracture in somebody age 50 or greater, well, 1 out of every 2 women are going to get a fracture. Well, that's quite a bit. 1 out of every 4 men, but it's still a high number. There's over 2 million fragility fractures in the United States alone each year. That's more than heart attacks, strokes combined. So if only 20% of these patients are getting treated, you think about the number of fractures, you know, and not only your difficulty recovering from those fractures, but just the cost of the healthcare. Here's that slide showing, these are just fractures. These aren't just patients with osteoporosis. There are only 44 million patients with osteoporosis in the United States. These are patients who fracture. And you're not going to know you have this unless you have a fracture and it starts hurting. So fragility fractures, 2.1 million. Heart attacks, 785,000. Strokes, 795,000. Breast cancer. All these combined, you still have more fractures. So the most common fracture sites that we see, well, is the wrist, distal radius. A lot of times just a simple fall, come in, wrist is hurting, distal radius fracture. And they tend to occur earlier than hip fractures do. So if you've had a distal radius fracture from just a minor fall, well, I would get seen and evaluated for osteoporosis, because if we can prevent that thoracic fracture, compression fracture, we can prevent a hip fracture, that's important. And I'll tell you why it's important. Because it's going to affect your mobility in your life. So here's the spine over here, okay, and you can get these wedge fractures. Those are just types of compression fractures. But all you need to know is it can create deformity, right? Normally it's kind of like this, we call kyphosis, kind of hunched over. Well, it can lead to loss of independence, disability, you have trouble doing things. Well, lack of self-esteem, it's associated with depression. Right? Oh, you know, I look the same, I'm getting old. And people become depressed. You lose height, this shows the curvature right here. I was talking about when you curved over like that, it's called kyphosis. And it can affect everything. You getting around, don't feel like eating, you have more trouble breathing, you're all hunched over, and it lead to other medical problems. This was a survey. These are some of the statements that people had made that had sustained these fractures, and this is from an Osteoporosis Society. Well, one, I look like I'm pregnant. My ribs are pressing on my pelvis. Hey, pelvis is down here, so all hunched over. I've lost 12 inches. You know, you hear everybody say, oh, I'm getting shorter with my age. I used to be 6'8", but now I'm only 5'4". That's a little exaggeration. I'm never 6'8". And then, you know, people say, oh, nothing can be done about the pain. My body shape has completely changed. I must have broken every bone in my body to look this way. It's just old age. Well, you don't have to take it. You can fight back. And to fight back, you need to be evaluated, and that's why we started that program, On the Bone. It's a national program that we've become involved in, and it's going to help a lot of people. Some people say, oh, my clothes won't fit anymore. Well, I guess I went from a long shirt, now I'm short. I see my mother's distress and wonder if I will be there one day. It happened to my mother, it happened to my father, it's going to happen to me. Well, it doesn't necessarily have to happen to you if you take some initiative and get evaluated. This is interesting. This is within 1 year after sustaining a hip fracture. 20% of the patients are admitted to a nursing home within 1 year after a fracture. And we'll get on to another slide which kind of hits home. 25% of people aren't alive 1 year after a hip fracture, too. So that's 45%. Either you end up in a nursing home or you're dead. So if that's not motivation to get treatment, I don't know what is. 60% report some difficulty with daily activities. Okay, I can't go garden. You know, a lot of people like to garden now, and I can't get out, I can't drive my tractor, or can't get out and cut wood. Restricted driving and shopping. 80% within 1 year it affects. Can't go to Walmart. You know, just take me. Well, I love Walmart. You know, it's just. So hip fracture is the most serious consequence of osteoporosis. Women experience 3/4 of all hip fractures, more women than men. And like I said, 25% of patients who suffer a hip fracture die within 12 months. You know, and those are the studies that have been done for a long time. And people need to realize how serious it is. So treatment, there's different types of hip fractures. There's different methods of treatment. Most often, if you sustain a hip fracture, you're going to have a surgery. There's rehab involved. There's different methods of fixation depending on the fracture. Anywhere from screws to hip replacements. And that's our job, do the right thing, but either way, you don't want the hip fracture. So, like I said, over 2 million of these fragility fractures, these patients that have osteoporosis. These are not the multi-trauma car accidents. Those are a whole separate category. This is just a simple fall in the kitchen, or I tripped over my dog. And then 44 million Americans are affected by this. There's more than 500,000 hospitalizations, 800,000 emergency room visits, 2.6 million office visits, and a place of nearly 180,000 people in the nursing homes. And right now, 5.1 billion hospitalization costs, 19 billion in osteoporosis-related fracture care. Unless we do something about it, the next projection is going to be $30 billion. But we can get some treatment and we can avoid all this. You have a better quality of life without the fracture and less cost to healthcare. So this is the compliance. I thought this is interesting. So the management after a fracture. So you have a fracture, you come to the emergency room, right? You get a splint put on, you have to go see your orthopedic surgeon. Well, only 20% are being managed for their osteoporosis after this fracture. Right? It's like, we need to do something about it. And so that's why we have that program, On the Bone. It's out there. You can take advantage of it. Like I said, the distal radius fractures generally occur first. If you've had a distal radius fracture from just a minor fall, I would definitely be checked for the possibility of osteoporosis. Because you could avoid that hip fracture later if you get treated. So, like I said, it's painless unless you sustain a fracture. You don't know you got it. We know something's fragile, you can break it a lot easier. glass, easier to break than steel. You can lose height, like we talked about. You have deformities. There's risk factors. Kristen's going to talk about bone density testing. And that's what you need. You compare your bones against other people your same age. And that's essentially what it is. So age, well, the older we get, higher the risk. Race, well, whites and Asians, greater than blacks. Medications, steroids, if you're on steroids, that affects bone density. So definitely if you're on steroids. Some of the breast and prostate cancer drugs, well, they work on hormones. So, and hormones help with bone density. Like we said, once you hit menopause, well, hormone levels go down, risk of a fracture goes up. Same thing with these drugs to fight cancer. That's the way they work. They affect the hormones. Rheumatoid arthritis, yeah, those medications, including steroids, can cause osteoporosis. Menopause, you know, there's different medical conditions like celiac disease or a bowel disorder. You're not absorbing the nutrients. Nutrients aren't getting to your bone. Bones are becoming fragile. Low body weight, you're not eating. Anorexia, higher incidence of fractures. Like I said, family history, genetics plays a part. Smokers, higher incidence of both fractures and bones not healing. Alcohol and caffeine, they say more than 3 drinks daily, bad on the bones. And if you've already had a fracture, you're at increased risk of another fracture. So after one fracture, 23% of all the other fractures occur within a year, 54% within the next 5 years. That's why I'm emphasizing, if you had a fracture, you know, seek help. How can I prevent other fractures? This shows just the effect on quality of life. I talked about this. Generally, the distal radius fractures, right there, late 50s, generally occur before spine and hip fractures. So hip fractures, generally it's around 70s, early 80s, pretty common. So we talked about this. What makes a fragility fracture likely? Well, poor bone strength, bones aren't strong. Risk of falling, you have a balance problem. Somebody refuses to use their walker or cane or somebody gave them. They want to remain independent and they fall. There's certain disorder like, you know, balance problems like Parkinson's. You know, you've seen somebody with Parkinson's, a lot of times they have difficulty with their balance, high risk of falling. And the impact of fall, well, probably less likely to break if you fall on something real soft than if you fall on a hard concrete floor. So there's different treatments after you've had a fracture. Chris is going to talk about a lot of these pain-relieving drugs, you know, Tylenol, there's narcotics. Who wants to get on narcotics? And there's codeine, you've heard about hydrocodone. Physical therapy is helpful. I send a lot of my patients, you know, walking programs, get some exercise, a lot of aquatic therapy. You know, a lot of patients come in and say, I just can't exercise, my joints hurt too bad. Oh, I said, well, okay, we'll send you to aquatic therapy. You can work in the pool, low impact, and so that excuse is out. We'll get you in the water. There's other therapies out there for pain, acupuncture, massage, ice, heat, TENS machines for chronic pain. For the spine fractures, the neurosurgeons or spine surgeons, they'll often do what's called a vertebralplasti. Essentially what they do, after you've had that compression fracture in your back, they'll go in there and inject some cement in the bone to try to make it stronger. Well, I'd rather have my own bone than have somebody inject cement in me. So we can prevent that. I think that's good. You know, after you sustain a hip fracture, we have a team, social workers, work with physical therapists, try to get you help, get you back on your feet, try to get you back to your house if possible. But like I said, 20% end up in nursing homes after a hip fracture. People need fall assessments. If you're falling a lot, need some kind of stabilization. You know, there'll be a walker or a cane, you know, help so you don't fall. There's drug treatment, and that's osteoporosis treatment, which Kristen's going to talk to you about. So in summary, osteoporosis is very, very common. 44 million Americans have osteoporosis. One study showed only 20% were being treated, even after a fracture. Eat a healthy lifestyle, daily exercise, good nutrition, and then the treatment if you need it. We want you to have a good quality of life and keep everybody going. That's our whole goal, and that's the goal of our On the Bone clinic. Help people, get them on the right path, and try to prevent some of these problems. These are some of the websites you can read about osteoporosis, and then we're happy to see you if you want to be evaluated, and Kristen's very knowledgeable, and I think we got a good person running our clinic. Thank you.